Hello, welcome. I'm Janak Goyal, and in this section, I will review some images of sonographic pathology of hand and wrist which I have seen in my practice. Here is an ultrasound image of the wrist of one of my patients with rheumatoid arthritis. The image shows a hypoechoic distension of the wrist joint capsule and a positive color Doppler signal indicative of active synovitis of the wrist joint. The color signal was so intense that I did not have to use the power Doppler to look for synovitis in this patient. This 45-year-old woman with rheumatoid arthritis presented with a swollen wrist. Sonography showed a heterogeneous non-compressible distension of the wrist joint with the negative color and power Doppler signals extending over the midcarpal joint consistent with synovial proliferation of the wrist joint. This 70-year-old man presented with acute painful swelling of his wrist. Sonography showed a heterogeneous compressible swelling of the midcarpal joint. 1.5 ml of fluid was aspirated under the sonographic guide, and examination of the fluid under polarized light microscope showed intracellular positively birefringent rhomboid crystals consistent with the diagnosis of pseudo-gout. This 60-year-old woman with rheumatoid arthritis presented with a cystic swelling on the ulnar side of her wrist. The sonographic examination of the wrist and the cystic swelling showed that the cystic swelling was a distension of the distal radial joint extending over the ulnar head and presenting as a cyst on the ulnar side of the wrist. The 70-year-old woman with rheumatoid arthritis has painful swollen wrist. The sonogram shows a erosion of the ulnar head and a positive Doppler signal consistent with active synovitis eroding the ulnar head. Here is the long axis view, and here is the short axis view of the ulnar head, and here is your distal radioulnar joint. This is a 72-year-old woman with long-standing rheumatoid arthritis. Now this video clip of the short axis scan at the distal radioulnar joint from proximal to distal shows a distal radioulnar joint effusion, erosion of the ulnar head, and subluxation of the extensor carpi ulnaris tendon. This is a 69-year-old man with painful bony swelling of the wrist and a past medical history of significant trauma. The sonogram shows a large projecting osteophyte from the lunate consistent with post-traumatic osteoarthritis. This is a 38-year-old woman with undifferentiated connective tissue disease who presented with a swollen right wrist. This sonographic image shows an isolated effusion of the fourth extensor compartment of the wrist. Here I have sonographic images from two patients with DeQuervain's tenosynovitis. This long axis and this short axis scan shows a hypoechoic thickening of the extensor retinaculum over the first extensor compartment in a patient with the DeQuervain's tenosynovitis. On the other hand, in the second image, the short axis scan shows only the involvement of the extensor pollicis brevis tendon with the pathological process. Here is this 54-year-old woman with rheumatoid arthritis and painful swelling of the right wrist. This sonogram shows the tenosynovitis of the extensor carpi ulnaris tendon. This is an 81-year-old man with numbness of hands. The sonogram shows a Bifid median nerve and a persistent median artery. This patient presented with a pulsatile swelling on the volar aspect of her wrist, and the sonogram showed a cystic swelling deep through the radial artery. This is a 75-year-old woman with a right middle finger pain. Now the sonogram in this case shows a hypoechoic and thickened A1 pulley on the volar aspect of the MCP joint. This 75-year-old woman presented with the symptoms of trigger finger. The sonogram shows a hypoechoic and thickened A1 pulley and a loss of fibrillar architecture of flexor digitorum superficialis deep to the thickened A1 pulley. This is a 46-year-old woman with rheumatoid arthritis who presented with a tender, swollen volar aspect of the left second MCP and symptoms of a trigger finger. The sonogram shows a very thick A1 pulley and a partial tear of the flexor digitorum superficialis. Here is the flexor digitorum superficialis and here is the lack of those tendon fibers, and here in the short axis scan you see the flexor digitorum profundus and the partially torn flexor digitorum superficialis. This is a 66-year-old woman with right fourth finger pain and tenderness on the volar aspect of the first phalanx. This sonogram shows a hypoechoic thickened A2 pulley at the volar aspect of the first phalanx. And also of note on the short axis scan is a split of the tendon of flexor digitorum superficialis for the passes of the tendon of flexor digitorum profundus deep to the thickened hypoechoic A2 pulley. This is one of my patients with long-standing rheumatoid arthritis, and the sonograms were taken on the MCP joint. Here you see the positive purple Doppler signal indicative of active synovitis on the MCP joint, and here the images show the erosions of the MCP joint. This is a short axis scan, and here is the long axis scan showing the erosion on the metacarpal head. Here is another patient with erosions of the metacarpal head. Here is the short axis and here is a long axis scan. This happens to be the erosions secondary to tophaceous gouts. This is one of my patients who is a 55-year-old man with a tophaceous gout and multiple erosions and multiple tophi in multiple joints. Now, this patient came with intermittent episodes of swelling and tenderness of the right, second and third MCP joint, and the left second MCP and PIP joint. The sonographic image showed a double contour sign on the metacarpal head. This is a short axis scan, and here is the long axis scan. The aspiration of the joint and the examination of the fluid under the polarized light microscope confirmed the clinical suspicion of gout in this patient.